is Sadula and I use she/her pronouns. I'm currently an M4 at Rush Medical College. Universal healthcare would have made a difference in my life when I was hit by a car at age 21 and needed medical care at a time when I was uninsured and could not access healthcare. Black Americans, Native Americans, and other patients of color experience a disproportionate rate of uninsurance and underinsurance compared to white Americans. Uninsurance is associated with an excess of at least 45,000 deaths per year. I want universal health care for my patients so they don't have to worry about choosing between paying rent or taking care of their health.
Hello, my name is Amber Donald. My pronouns are she, her, hers. I am a pre-medical student and recent graduate from the University of Florida. Universal healthcare is extremely important to me and my future patients because I believe healthcare is a human right. Black Americans face a disproportionate impact to the cost of healthcare. Many cannot afford the $400 medical emergency fee, nor do their liquid assets cover their out-of-pocket deductible before insurance kicks in. This financial barrier should not be in place for people wanting to obtain holistic wellness and take care of their bodies.
Hi, I'm Marisol. My pronouns are she, her, and I'm a third-year medical student at Drexel University. Universal healthcare is so critical because we need a system that addresses the needs of the most vulnerable right now. I'm currently in a city where the segregation has actually worsened in the past 150 years, and that's reflected in their current health system. I've seen patients turned away from top-tier hospitals and sent to the community hospital because their insurance doesn't cover the cost. It has been shown that guaranteed health access closes racial health gaps. For example, the VA health system provides low-cost medication to everyone with VA insurance. Studies have shown that providing low-cost medication in that setting eliminated disparities in cost-related medical adherence, meaning that when people can afford their medications, they are more likely to take them. Another study showed in 2020 that African American men in the VA system did not appear to have more aggressive prostate cancer at the time of diagnosis than other racial groups.
Hello, my name is Rex Ty, and I go by he, him, his pronouns. I am a fourth-year medical student at the University of Illinois at Chicago. One of my most formative experiences as a medical student has been volunteering at a free medical clinic, taking care of patients, largely uninsured, who have nowhere else to go. It's been very rewarding work, but I see all the ways in which this level of care at an underfunded clinic is not enough for many of our patients with some of the most complex medical needs. To change this, I look to the historical example of Medicare, which was the most significant transformation to health coverage in United States history. It enabled desegregation of all U.S. hospitals and drastically reduced rates of medical bankruptcy for elderly patients of all races, achieved through the efforts of progressive physicians and civil rights activists working together in coalition. We should continue this work of achieving the interlocking goals of racial and economic justice that came out of this era, but we must not stop there.
Hello, my name is Candice Grisham and I am a second-year MD-PhD student at Vanderbilt University. Universal health coverage is important to me because the future of our nation rides on the health of all citizens. And this future cannot be jeopardized by the inability to afford healthcare. The issue of universal healthcare is particularly important to communities of color. 85% of Black and Latinx people believe that the federal government should ensure health coverage. Universal healthcare will not solve racism, but it is imperative to note that racism is perpetuated by continually under-addressed health disparities. Crafting a health system around universality that allocates care by medical need rather than profit is one of the most important first steps to rectifying racial health inequalities suffered by Black and Latinx patients, as well as other communities of color.
Hello everyone, my name is Angel Gabriel, my pronouns are she, her, and hers, and I am a first-year medical student at Howard University College of Medicine. In the midst of the COVID-19 pandemic and our nation's reckoning with systemic racism, now is the time to advocate for universal health coverage to combat health disparities in the United States. The Student National Medical Association recommends that all U.S. citizens and residents should be guaranteed a portable, comprehensive benefits package, including prescription drugs, dental care, inpatient and outpatient mental health services, long-term care, optometry services, choice of provider, and a greater focus on preventive health. Our colleagues at the Students for a National Health Program strongly agree that all people deserve comprehensive, affordable health care. This is why we are partnering to elevate the cause of universal health care. Share this video to support patients and say yes to universal coverage. Thank you.